A very good morning to all the doctors and everybody who have joined the webinar today. It's a pleasure for us to have you all here. This is Dr. Shivangi Singh and I feel very fortunate that I have gotten this opportunity to present the topic Understanding Uric Acid and Gout with Radaropus. And I'm very thankful to the BGN RX and BGN publication for giving me this opportunity to present this topic in front of you all. So basically, gout is also known as disease of kings because rich foods have a higher concentration of protein. This could cause major problem for a person affected with gout. So let's begin with the introduction. Gout comes from Latin word gutta, Old French word gout meaning a drop. Several hundred years ago, gout was thought to be caused by drops of viscous humor that seeped from the blood into the joints. Gouty arthritis is one or more joint but less than four. May be precipitated by trauma, surgery, alcohol ingestion, and infection. Gout has been recorded in the medical literature since ancient times and also been mentioned in the biography of many distinguished personality. It is a metabolic disease that results from an increased body pool of urate with hyperuricemia. It typically is characterized by episodic acute arthritis or chronic arthritis caused by deposition of monosodium urate crystal in joints and connective tissue tophi and carries the risk for deposition in kidney, interstitium, or uric acid nephrolithiasis. So this was all about my introduction part. Now I'm moving on my next slide, that is definition. So the definition is acute inflammatory monoarthritis caused by precipitation of monosodium urate crystal in joints. Uric acid is a normal end product of the degradation of purine compound in which major route of disposal in renal excretion. Humans lack the enzyme uricase to break down uric acid into more soluble form. So it can be defined as a pathological reaction of a joint or pre-articular tissue to the presence of monosodium urate monohydrate crystal. Gout is most common form of inflammatory arthritis and is characterized by acute intermittent episodes of synovitis presenting with joint swelling and pain. Gout is a form of inflammatory arthritis that results from an excessive of uric acid in the blood. Among people with gout, 90% have kidney that don't adequately remove uric acid from their urine, while 10% have high uric acid level because they produce too much uric acid. Now, after definition, I'm moving on my epidemiology part. Most common of microcrystalline arthropathy, about 10% of people with hyperuricemia develop gout at some point in their lifetime. Gout is 5%, 5 times more common in males, depending on the degree of hyperuricemia. While level are between 415 and 530 mu mole per liter, while in those with a level greater than 535 mu mole per liter. So in epidemiology, let me discuss more about. The globally the prevalence of hyperuricemia ranges between 2.0 and 13.2%, and the prevalence of gout is between 1.3 and 3.7%. The higher the serum urate level, the more likely an individual is to develop gout. In the last few decades, the prevalence of hyperuricemia is increasing rapidly in the world population, not only in the developed country but also in the low and middle income countries. Lifestyle factors like obesity, purine abundant diet, and alcohol intake have been known to favor the development of hyperuricemia. Now let me discuss more about the causes of gout. The main cause of gout arthritis is the underlying hyperuricemia, that is serum uric acid level more than 6.8 mg per dl. Uric acid is the end product of endogenous and dietary purine metabolism which is being excreted by the kidneys. So basically, hyperuricemia occur when there is increased production of uric acid, which can be due to dietary factors, liver, red meat, organ meat, and shellfish. Alcohol is most common cause. Decreased uric acid excretion, which can due to decreased glomerular excretion, decreased tubular secretion, increased renal absorption, or both. So this was all about my epidemiology part. Now moving on my next slide, that is pathophysiology. Now, the pathophysiology of gout: uric acid is an product of purine metabolism and excreted by the kidney. As I told you, we discussed in the above slide, hyperuricemia result from increase in uric acid production, under excretion of uric acid by kidneys, or both. Diet high in purine will not cause gout, but may trigger an attack in a susceptible person. As already told, there will be hyperuricemia due to any of the above mentioned causes. This elevate uric acid in the blood is saturated and is deposited as monosodium urate crystal. This crystal usually get deposited in areas where blood supply in poor, like in joints, where it interacts with the leukocytes and initiates inflammatory responses, resulting in acute gout. Further attack of acute gout resulting in recurrent or chronic gout. Now, the next slide is about stages, the type of gout. The four stages of gout can be seen: asymptomatic gout, acute gout, intercritical gout, and chronic gout. Now I'm going to start with my first type, that is asymptomatic. Asymptomatic, a very common biochemical abnormality. Majority of people with hyperuricemia never develop symptoms to uric acid excess. A meaning without indicates that there are no symptom associated. Patient will be unaware of what is happening. Gout can only be determined with the help of a physician. So, I'm going to discuss more about the asymptomatic hyperuricemia. It is a stage in and of itself that does not constitute gout. However, an asymptomatic phase of gout in which deposition of monosodium urate crystals take place. Patients do not require treatment during this stage, but effort should be made to lower their serum uric acid by encouraging them to make changes in their diet and lifestyle, thus preventing gout. Now, moving on my next type, that is acute. Second one is acute gout. Episode of acute gout, symptoms may be confined to a single joint or patient have systematic symptoms, severe and sudden onset, and involve one or a few joint. Frequently start nocturnally. Joint is warm, red, and tender. So basically, in acute gout attack may occur without an initiating factor, or they may be precipitating by a number of conditions such as minor trauma, alcohol use, surgery, fatigue, rapid weight loss, infection, drugs, and high purine gout. Acute gout is characterized by the sudden onset of pain, warmth, tenderness, erythema, limited ranges of motion, and swelling of the involved joint. It is firstly because the extremities are cooler than other part of the body, and monosodium urate crystallize readily at lower temperature, and secondly because feet undergo stress during normal walking or standing. Together, these factors explain why the three metatarsobpharyngeal joint, forefoot, heel, and Achilles tendon are attacked first. Now I'm going to discuss about the other targets, especially in untreated patient with recurrent attack of gout, are the knee, elbow, wrist, finger, and less often the shoulders, pelvis, spine, and internal organs too. Acute gout may be accompanied by leukocytosis, increased erythrocyte sedimentation rate, and C-creative protein. Now the next type is intercritical. In intercritical, symptom-free period interval between attacks may have hyperuricemia and monosodium urate crystal in synovial fluid. more concentration of uric acid crystals, typically no need for drug intervention at the time. So at the time of acute attack, mostly a second attack occurred within 1 year. The frequency of attack gradually increased with more joint involvement and joint damage. The following recovery from acute gout, the patient re-enter an asymptomatic phase of the disease. This phase is referred to as intercritical gout or interval gout. It is the interval between attack of acute gout whereby the patient is symptom free. So the duration of intercritical stage can range from month to years. It is during the intercritical phase that the physician should focus on secondary cause of hyperuricemia. The medication should be assessed to identify those that they may aggravate the patient's condition. For example, like diuretics, if the patient is used, and the dietary education regarding the purine rich food should be provided to the patient at this time. The next part is chronic gout. Last one is chronic gout. The result from the established disease and refer to stage of deposition of urate, inflammatory cells, and foreign body joints cell in the tissues. Deposits may be in tendons and ligaments, continuous or persistent over a long period of time and not easily or quickly resolved. Usually develop after 10 or more years of acute intermittent gout. So the chronic tophaceous gout are large monosodium crystal deposit produce irregular film nodules that we call toffee around the extensor surface of finger, hand, forearm, elbow, Achilles tendon, and sometimes the helix of ear. White color of monosodium urate crystal may be evident. Large nodules may ulcerating discharge white gritty material and associated with local inflammation. The rate of urate deposition and subsequently the rate of toffee formation correlation with the duration and the severity of hyperuricemia. Complication of toffee include pain, soft tissue damage, and deformity. Joint destruction, nerve compression syndrome such as carpal tunnel syndrome can be seen. The basically severe functional impairment and gross deformity may occur. Tophi are nodular masses of monocrystal of monosodium urate and amorphous urates surrounded by histocytes, joint cells, and fibrosis. Tophi appear in the periarticular or subarticular tissue of the joint. If located superficially to the skin surface, tophi are visible and appear nodular and white or yellow in color. The ulceration of skin can allow crystallized exudates to develop. So this was all about the types. Now moving on my next slide, that is clinical manifestation. Gout arthritis is in one or more joint. Onset usually nocturnal with sudden swelling and excruciating pain. Grade 2 joint most common first manifestation. Other joints may be the foot, ankle, knee, or wrist. Joint pain usually begins over 2 to 4 hours and during the night. May have low grade fever. Joints are tender and cyanotic. Now the next one is sign and symptoms. The symptoms in the affected joints may include intense pain, redness, stiffness, swelling, tenderness, even to light touch, such as from bedsheet, warmth, or a feeling like the joint is on fire. Some other symptoms I'm going to discuss, like intense joint pain. Because gout usually affect the big toe, but it can occur in any joint. Other commonly affected joints include the ankle, knees, elbow, wrist, and finger. The pain is likely to be the most severe within the first 4 to 12 hours after it begins. The next one I'm going to discuss, that is lingering discomfort after the most severe pain subside. Some joint discomfort may last from a few days to a few weeks. Later attacks are likely to last longer and affect more joints. Now, this was all about the sign and symptoms. I'm moving on my next slide, that is the risk factor. The risk factor includes a family history of gout, obesity, untreated hypertension, diabetes mellitus, metabolic syndromes, high alcohol consumption, certain interrejection medication if you have had an organ transplant, use of certain medication such as diuretics and aspirin, recent trauma or surgery. Males after the age of 50 years are more prone to get gout. Female after menopause, diet rich in seafood. So in risk factor, the weight is the most common factor, that is we call obesity. If you are overweight, your body produce more uric acid and your kidneys have more difficult time eliminating that uric acid. And the age and sex, if we discuss about the male, after the age of 50 years or more, males get affected easily. So the reason is gout occur more than in men, primarily because women tend to have lower uric acid level after menopause. However, women's uric acid level approach those to men are also more likely to develop gout earlier, usually the between of ages 40 and 50, where women generally develop sign and symptom after menopause. Like medical conditions are also the risk factor, like certain diseases and condition increases your risk of gout. These include untreated high blood pressure and chronic conditions such as diabetes, obesity, metabolic syndrome, kidney and heart diseases. And I'm going to discuss about the risk factor of certain medication like low dose aspirin, some medication used to control hypertension, including thi- thiazide diuretics, angiotensin converting enzymes, inhibitors, and beta blockers. Also can increase uric acid level. So can the use of anti-rejection drugs prescribed for people who have undergone an organ transplant. The dietary management. At the last, I'm going to discuss about the dietary managements. Weight reduction, avoidance of alcohol, more low fat dietary products, avoidance of food high in purines, high like mussels, kidney, liver, meat soup, sweet bread, beer and wine, moderate like chicken, salmon, crab, mutton, pork, beef, ham. Vitamin C intake of 1500 mg per day decrease the risk of gout by 45%. Coffee but not tea consumption is associated with a lower risk of gout. Now I'm going to discuss about the more about the journal management or the dietary measures of gout, like weight loss, reduction of excess alcohol intake, especially beer. This we discuss in the PPT. Diuretics should be stopped if possible. Purine diet should be tempered like seafood and red meat. Now I'm going to discuss about some dietary recommendation for gout. Like overweight patients should aim for a normal weight, but should not crash diet or follow protein rich diet such as the Atkins diet. Reduce fat food and vegetarian source of protein should be integrated into the diet. Protein rich food such as meat, offal, and yeast should be avoided. Patient known to suffer from gout and kidney stones should be instructed to consume sufficient fluid. So this was all about gout from my part. Now I'm going to discuss a live case with you all. A male patient of age 42 years reported at my clinic with a complaint of pain and swelling of left toe, sole of foot since 2 years, pain in the left knee joint since 2 years, and pain in the both wrist joint since 1 year. The left toe felt as if he sprained it and was very painful to touch. The right toe was normal. His left first metatarsopharyngeal joint felt sore with a slight throb as if someone hammered his toe. The pain improved with the heat packs, rest, and holding the joint with his hands. He bandaged his foot to keep it warm, got worsened with movement on touch, and lying on the painful side. Now, the history of present illness. Patient was apparently normal. Before 2 years, then pain started first in left metatarsobopharyngeal joint, gradually then spread to sole of left foot knee joint. Both both wrist joint since 2 years. His gout began 2 years ago. Gout had previously attacked his first metatarsobopharyngeal joint and knee. His present attack started 2 days ago from walking a long distance in uncomfortable shoes. When he got home, he immediately took off his shoes because his feet were burning. Pain and swelling of left great toe and sole of the left foot, aggravation by walking, pain in the left knee joint, aggravation by walking, amelioration by wrist, pain in the both wrist joint, aggravation by holding things, folding hands. So as we discuss in this slide, his present attack started 2 days ago from walking a long distance in uncomfortable shoes. So when he got home, he immediately took off his shoes because of his feet were burning. The left toe felt as if he sprained it and very painful to touch. That night, he argued with his wife that he was fine, but his left toe was incredibly painful and swollen. The right foot was normal. He realized then that it was a gout attack and hoped it would away by the next day, but it didn't. His left first metatarsobopharyngeal joint felt sore with a slight throb as if someone hammered his toe. The pain improved with a heat pack, got worsened with movements and on touch. So basically, on examination, he complained of pain when the examiner approached the joint. His joint was blue purple in color, tender with veins and withdrawal and edematous. He had numbness with a loss of light touch, pain sensation over the joint. Now, in past history, he had a past medical history of pulmonary tuberculosis 4 years back and no other history of past illness. In family history, his father died because of myocardial infarction and mother is suffering from diabetes mellitus. Now, mental journals. Mentally, he is healthy. He's tired of taking medicine, so he avoided if he can. He believe in natural healing like home remedies, reflexology, herbs, and homeopathy. He is independent, confident, and friendly. He complained of losing a feeling in his fingers, toes, and of sinusitis, anxiety about his condition or health, impaired memory, fear of misfortunes. Patient gets offended easily. Now, the physical journals. The thermal reaction of my patient, chilly patient, as complained get worse at cold climate. In appetite, his appetite was normal with no loss or gain. Taste, spicy food, desire to eat meat. Digestion, he felt hungry but couldn't eat. Thirst, he is thirsty normally and drinks more than 8 glasses of water daily. In urine, no changes in urination was noted. He normally urinates frequently and profusely. So the stool is normal, satisfactory once in a day. Sleep disturbed, wakes up at night. Dreams not specific. Thank you so much for staying with us. We will be starting the presentation and training. How can we repertorize this case with the help of Radaropus? Now I'm going to repertorize my case with the help of Radaropus software. Now I will be sharing my screen to all of you. So this is Dr. Shivangi and I will be demonstrating you all about how you can get started with Radaropus. How can we repertorize the case? Before I start, let me explain to our viewers how this interface works. On the right hand side panel of your screen, you have a short chat box. You may type your question or whatever message you have right there and press button next to it to send it to us. Okay, so whenever you open your Radaropus software, you will be able to see your screen exactly like this. Synthesis Adonis repository is by default open. The above icons are known as icon bar or toolbar. And these five icons which are present on the left hand side of your screen are known as primary icons, consist of repertories, references, patient management, remedies, and families. So I'm going to repertorize my case. So for repertorization, first of all, I'm going to this repertories icon. If you click on this icon, you will get all the list of repertories that are listed over here. Radar comes with more than 30 repertories, including synthesis. So today I'm going to do my repertorization from synthesis Adonis repertory. One more thing I'm going to tell you, this repository is a successor version of Synthesis Treasure Edition. Okay, now my repository have opened on my main display screen. So for doing the repertorization from this repository, I will be needing few icons. The first icon is this binocular. Find rubric. If you click on this binocular, you'll get this navigation window. It contains all the chapters that belongs to this particular repository. So now I'm going to repertorize my case. So the first symptom of my patient is having the weakness of memory, as we discussed in our presentation. The patient is having the weakness of memory, have the problem in concentration or having the problem in memory. So I'm going to the mind chapter because this symptoms belongs to the mind chapter. If you click on this chapter, you'll get all the rubrics. You can just search your rubric with the help of this scroll bar, like scrolling this. Else you can type your symptom in the front of this, start typing the first letter of the rubric you wish to see. Now my patient symptom is having the weakness of memory, so I'm typing here memory. Just write down the initial, you will get your rubric below. Memory, weakness of memory is already mentioned here. Now I enter on my keyboard. Now my rubric have opened on my main display screen. From mind chapter, memory is my rubric, weakness of memory is my sub rubric. We have multiple clipboards here. You can see here we have multiple clipboards here. They are just like our repertorial sheet for doing the repertorization. I'm going to add my rubric into this clipboard and it will automatically get repertorized. So for taking any rubric in the clipboard, we have three methods. The first one is dragging and dropping. With the help of your cursor, you can drag it and drop it like this. Next two method I'm going to tell you with my two subsequent rubrics or two subsequent symptom. Next symptom, my patient is having the fear of misfortunes. So fear is also a mental symptom. I'm going to the mind chapter again. I'm going to type here fear. Just write down the initial. You will get your rubric below. Fear. Misfortunes of. Now enter on this. Now my rubric have opened on my main display screen from mind chapter. Fear is my rubric, misfortune of is my sub rubric. Now I'm going to add this second rubric in my clipboard with the help of my second method, and my second method is plus button. The plus button on your keyboard is the second method. As soon as I pressed my plus button, my rubric is added to the clipboard. I'm going to take my next symptom. The next symptom of my patient is having anxiety about his health. So anxiety is also a mental symptom. I'm going to the mind chapter. Now I'm typing here anxiety. In front of this, start typing the first letter of the rubric you wish to see. Anxiety. Just write down the initial. You'll get your rubric below. This I told you earlier. Anxiety. Health about. Enter. Now your rubric I've opened on your main display screen exactly like this. From mind chapter, anxiety is my rubric, health about is my sub rubric. Now I'm going to add this third rubric in my clipboard with the help of my third method, and my third method is this icon. Take the current rubric icon. Next to this binocular, you will get this icon, take the current rubric icon. If you click on this icon, your rubric is added to the clipboard like this. We have three methods. The first one is drag and drop. Second is plus button on your keyboard. And the third button is this icon, take the current rubric icon. I'm going to take my next symptom. Next symptom, my patient is offended easily. So if offended is also a mental symptom, going to the mind chapter again. Offended easily. Now my rubric have open on my main display screen from mind chapter. Offended easily is my rubric. Now I'm going to add this rubric in my clipboard with the help of dragging and dropping method like this. Now my rubric has been added in my clipboard. The next symptom, my patient is having the pain in wrist joint. Now I'm going to the extremities chapter. Extremities, pain, wrist, on motion. My patient is having the pain in wrist while motion. I'm going to take this, that is from extremities chapter, pain, wrist, motion, aggravation. I'm going to add this rubric with the help of my second method, and my second method is plus button on my keyboard. Now, as soon as I clicked on my plus button, my rubric is added to the clipboard. Now I'm going to take my next symptom. Now my patient is having the pain in first toe. So I'm going to the extremities chapter again. Extremities, write down pain, toes, first. You'll get this first. Now enter. Now you'll get your rubric from extremities chapter. Pain is my rubric. Toe first is my sub rubric. Now I'm going to add this rubric in my clipboard with the help of my dragging and dropping method. Okay, the next symptom I'm going to take. My patient is having the stitching pain in joints. In joints, the patient is having the stitching pain. So again, I'm going to this extremities chapter. Pain, stitching pain. Now just enter on my keyboard. You will get your rubric from extremities chapter. Pain is my rubric. Stitching pain is my sub rubric. Now I'm going to add this rubric in my clipboard with the help of my third method, and my third method is this icon. Take the current rubric icon. If you click on this icon, your rubric has been added to your clipboard. The next symptom, my patient is having the pain in feet, sole of his feet. My patient is having the pain. So I'm going to the navigation window again. I'm going to the extremities chapter. Pain, feet, soles. I'm going to add this rubric, that is from extremities chapter. Pain is my rubric, feet and soles are my sub rubric. Now I'm going to add this rubric with the help of my first method, that is dragging and dropping. You can drag it and drop it. The next symptom, my patient is having the pain in left knee. left knee. So I'm going to the extremities chapter again. I'm going to type here pain, knees, left. My rubric have open on my main display screen from extremities chapter. Pain is my rubric. Knee left are my sub rubric. Now I'm going to add this rubric in my clipboard with the help of my second method, and my second method is plus button on my keyboard. As soon as I pressed my plus button, my rubric is added in my clipboard. The next symptom of my patient is having the heaviness in knee joint. So I'm going to the extremities chapter. Write down here heaviness, knees. Now I'm going to add this rubric in my clipboard with the help of my third method, that is this method. Take the current rubric icon. If you click on this icon, your rubric is added to the clipboard. Now the next symptom I'm going to take. A patient is having the uh, problem in sleep, having disturbed sleep. So I'm going to the sleep chapter. Sleep, disturbed. I'm going to add this rubric in my clipboard with the help of my dragging and dropping method. You can drag it and drop it like this. Drag it and drop it. Now I've taken all my rubrics in my clipboard. Now I'm going to my clipboard. So just click on your clipboard, you'll get your analysis, you'll get your chapters, rubrics, sub-rubrics, you'll get your probable remedies, you'll get your gradings. Now I'm going to tell you, we have taken 11 rubric here. We have taken all 11 rubrics here. So Costicum cover all the 11 rubrics you can see here, and the grading will be 20. If you add these number like 3 plus 2 plus 2 plus 3, 1, 1, the total will be 20. Sulfur cover 11 rubrics out of 11 and the total will be 16. Phosphorus cover 10 rubrics out of 11 and the total will be 16. In the same manner, you will get your grading. And one more thing, if you want to read any remedy from your probable remedy list, you can open it directly by double click on it. If you want to read your causticum, so just double click on your causticum and your causticum will open on your main display screen like this. One more thing I'm going to tell you, our software is all-in-one interface. Whatever icon you open will remain open in different tabs. Like in this first tab, you'll get your synthesis Adonis repertory. In the next one, we have the causticum. And in this tab, my analysis remains open. So I just click on it. Now I'm coming back to my analysis. Suppose you want to read your phosphorus. Just double click on your phosphorus. Your phosphorus will open on a main display screen with a multimedia image of their plant. You can read it by scrolling like this. I'm going back to my analysis. So according my grading or the totality, I'm going to prescribe the causticum remedy. I'm going to select this remedy for my patient for the totality on the basis of totality. So I'm going to my prescription part. Medicine I have prescribed, that is causticum 200 in 3 doses, 8 hourly, followed by placebo 34 pills TDS for 7 days. Was prescribed on first visit considering the repertorial totality as we discussed in our repertorization. In journal management, food high in purine should be avoided. Patients should avoid refined carbohydrates, particularly sugar, white flour, products, fried foods, and most important, alcoholic beverages. In the next follow up, in the second follow up, patient presented with knee joint pain, left great toe pain and swelling slightly reduced. He complained of an unbearable wrist pain on moving the joints and on touching the affected area. He was unable to walk or put pressure on the affected area. Sleep, energy level, muscle pain improved. Mentally, he became more irritated. His medication and doses continued. So I have prescribed again causticum 200 single dose state orally, followed by placebo 4 pills, BD for 10 days. In journal management, limiting the consumption of alcohol, purine, high fructose corn syrup can be prescribed to my patient. In the third follow up, in the last follow up, the patient complained that even though his pain and swelling was gone, he could move the affected joint as well as all the others. He felt tired and had a light sleep. His muscles aches resolved. 90% of resolution of all his complaints with no relapse had taken place. Prescribed, so I prescribed placebo, BD for 10 days. So this was all about my case. This is my repertorial sheet. So this was all about the gout. How can we repertorize the case with the help of synthesis Adonis Radaropus software from my part. All right, now I would like to request to all the viewers to comment in the chat box with their questions now. We will begin the question answer session. So I'm going to take my first question. Let me take it. So a learner wants to know, is vitamin C good for gout? Is vitamin C good for gout? So vitamin C has been shown to have a small effect at helping the body improve uric acid, but is not recommended for gout treatment since other options are much better and more effective. So we cannot say this vitamin C is good for gout, or we can treat with the help of this vitamin C. Okay, the next question I'm going to take, we will okay, now I'm going to take the next question from a viewer side. How homeopathy helps to cure gout? This question is interested. Homeopathic remedies can provide a measure to relief during painful attacks of joint pain and inflammation. A constitutional remedy prescribed by an experienced homeopath may help to reduce other episodes. Homeopathic remedies are helpful to reduce the swelling and inflammation as well as the aid in the healing of the joints. I hope you are satisfied with my answer. Now I'm going to take the next question. Another question from a viewer side is, an excessive amount of uric acid in the body can also lead to what condition? Okay. Uh, an excessive amount of uric acid in the body can lead to what condition? Basically, it leads to kidney stone. As mentioned before, gout is not only the manifestation of excessive uric acid in the body, uric acid can also form kidney stones too. So this condition can lead to kidney stone. Now the next question I'm going to take, next one is, what is the most common site of gout attack? This we already discussed in the PPT, but okay, I'm going to answer this. The most common sign of gout in a night time attack of swelling, tenderness, redness, and sharp pain in the big toe. Gout attack also appear in feet, ankles, knees, fingers, heels, and elbow. These are the most common site of gout attack. I think we have almost taken up all the question. So let's wind up here. No. So let's take the last question from a viewer side is. I'm going to take my last question. How gout is a form of arthritis. Okay, gout is a painful type of arthritis that develop when uric acid builds up in the body, leading to the formation of uric acid crystal in the joints. The big toe is a common site affected by gout, but it can also affect other joints, including the knees, ankle, heels, other toes. Affected joints are painful, red, swollen, and warm. Okay, so let's wind up here. Thank you, everyone. I would like to thank all the viewers, the homeopathic fraternity who have joined us here today. Thank you. Thank you so much. Have a great day. Keep learning, keep improving.